So thank you very much for inviting me to do this semi-quick introduction into acupuncture. What I think is most commonly used is acupuncture in pain. So what I will show is a simplified view of how, and I hope you all can see what I'm drawing here. This is supposed to be the spinal cord. You can tell it's from a Swede because it doesn't look very even. Anyway, what we have in our system here is that we have the typical pain system. So first we would have the typical nociceptors here. So here we have our nociceptors sending information into the spinal cord of what is going to be interpreted in the brain as pain. And the reason for showing this is that acupuncture is basically and most commonly accepted as a tool to treat pain. So from the spinal cord here, we do have activity going up in the ascending tracts into the brain, first into the brainstem, into thalamus, and from the thalamus, the activity is conveyed into the brain in different ways. So this is supposed to be a brain here. So what you will find is that the pain is going into thalamus, and then from the thalamus, pain is conveyed into the limbic structures. So a lot of the activity that we are going to see when we have pain is that we have increased activity in limbic structures, and that is, for example, amygdala and hippocampus. So what you find here is that you have basically, this is the emotional aspect of pain. And this also shows that the first percept, and from a clinical perspective, it basically means that when you have a patient in pain, it is an emotional experience. And it is individual. The other thing that we know is that the pain is also conveyed into the somatosensory cortex. So here we have the somatosensory cortex. Typical for this part is here we have the intensity, we record the intensity, and we do record where the pain is coming from. So this is the discrimination that we have. And then, of course, pain is also conveyed into the prefrontal cortex over here. So here we have the prefrontal cortex. Typical for these areas is here we do have the cognitive aspects of pain. So this is the basic setup that we have when we have pain. An interesting aspect that has evolved during the last years is that pain in some patients also actually activate the reward areas. So in some patients, pain is actually quite closely related to reward activation. And this has been shown to be important when pain becomes chronic. So this is the basic setup of the pain system. Of course, the body is built to prevent this from going on for a too long time. So pain itself is going to trigger different systems that may actually inhibit the pain. So pain here, set up here. So here we have the perception of pain is then activating descending mechanisms that may inhibit the pain. The obvious question then is, where may you have an effect with your acupuncture needle? In other words, is it important where I place needle and how much stimulation should I give when I do my stimulation? So if we first look here in the periphery, what I'm going to address now is the different effects that we may have with our acupuncture. So part of the effects of acupuncture are going to be in the periphery. Part of the effects are going to be on the spinal cord, systems. And then basically part of the effects are going to be in the central systems. So when we are treating a patient with pain, we may actually expect effects in the periphery, expect from a segmental level, and also we will have general effects happening up in the brain. So what we have is looking into the periphery. In other words, is there any kind of relevance where we put our acupuncture needles? So this is the acupuncture needle going into the skin and into the muscle tissue. So most of the acupuncture points that we find in the body are actually found in muscle tissue. Most of them. So the question is, what is happening when we're putting in our acupuncture needle here? Well, a number of things are happening in the periphery. In other words, we do have peripheral effects of our needling. So there is a relevance that we put needle in the right place. So one of the things that we will find here is that soft tissue or connective tissue, when we are inserting our needle, the soft tissue here is releasing around the muscle and also within the muscle is releasing ATP. And this ATP, which is adenosine triphosphate, is then converted slowly into ADP, and then it's converted into adenosine. So what we have in the peripheral tissue when we put in our acupuncture needle, released from connective tissue, is adenosine. Adenosine is interesting for two reasons. One is that adenosine itself may actually bind to nociceptors on the peripheral afferent nerves. So adenosine may bind to A1 receptors and then may actually inhibit the signals from this area. So one of the reasons could be actually that we may have a small anti-nociceptive effect from the acupuncture needle in the peripheral site. Adenosine is also doing another thing. Adenosine is also binding to the epithelium of blood vessels. So what we will find is adenosine is that it actually binds here also to the epithelium here and then induces the release of nitrous oxygen. And nitrous oxygen is a very potent vasodilator. So this basically indicates that what we are having two effects at the peripheral site by the acupuncture needling. One is pain inhibition and the other one is a vasodilation. So NO, that's corresponding to nitroglycerin at the local site. Of course, the acupuncture needle is also going to activate receptors in the muscle tissue. And the other set of receptors that we find here within the muscle tissue, and likely very important for the acupuncture effect, that is receptors that we call the ergoreceptors. So when we do acupuncture, and especially when we are evoking the qi, we are activating a muscle receptor that is found in the muscles, of course. Typical for the ergoreceptors is that they are activating by a strong muscle stimulation. So in other words, when we do det qi, these muscle receptors are activated. And from these receptors, there is release of another compound called CGRP. So what you will find here is that you're having a release of CGRP, and that is calcitonin gene-related peptide. And calcitonin gene-related peptide is also a very potent vasodilator. So in other words, we have two potent vasodilators that are released locally. That is one of the effects. So in other words, if we are treating local ischemia, like local muscle ischemia, we have a very good mechanism explaining why we may inhibit these conditions, where we have ischemic conditions here, for example. So, and the other thing what CGRP is also doing is that CGRP is also having a trophic effect. In other words, it stimulates the growth of the epithelium. So this basically indicates that if we want to have a more long-standing effect, we need to repeat the treatments, for example, in wound healing, to have a prolonged effect. So it's not enough with one treatment. So we have two different treatment effects. One is the release of two different potent vasodilators, NO and CGRP, and we also have a trophic effect in the tissue, for example, going for wound healing. So now going into so there are peripheral effects. So this basically shows, the first part here shows, it is important to be in the correct site treating ischemic conditions. The other thing is that what we also said is that some of the effects that we have are going to be in the segmental level. In other words, when we are doing our acupuncture needling here, the acupuncture, and here we have our ergoreceptors. Oops. The ergoreceptors sets up activity here in the spinal cord level. Part of these effects are related to sympathetic tone. So what we're going to see is that when we do acupuncture, the acupuncture stimulation is going to trigger a sympathetic response. So what we have here is that we're going to find an increased sympathetic tone in the tissue. And this increased sympathetic tone may affect the skin. In other words, some patients may respond with a decreased or feeling of coldness in the limb. Another reaction may be that we may affect the muscles. In humans, basically, it's believed that the increased sympathetic tone is not that important, but if anything, it does increase the blood flux. So this is the muscle. And of course, we're going to have an effect on internal organs. So visual organs are going to be affected on the segmental level. So when we're putting our acupuncture needle in the muscle, we're going to trigger reflexes that are affecting the function of visual organs. So this is what you will call somatovisual reflexes. So if you would take the gut, for example, the typical effect that you would have would be that you would inhibit the activity in the gut when you do short-term acupuncture. However, if we've been treating the patients, so the typical response would be like this. So this is the stimulation of the acupuncture needle, and this is the effect on the sympathetic tone. It is actually going up during the same time. So this is sympathetic tone. However, if we have been stimulating for a longer time, so if we've been stimulating for, say, here 20 minutes, so this is just one dead chi. But if we have repeated our stimulation here for 20 minutes, we're going to find another response. What we're going to have then is that we're going to have a decreased sympathetic tone, which may last for up to about 18 hours. So this basically shows, what I'm trying to show here, is that depending on how long time we are stimulating with our acupuncture needles, we may have two effects. So the acute effect is, in other words, doing the stimulation, the acute effect is an increased sympathetic tone. But if we've been stimulating for 20 minutes, we are getting an increase during stimulation, which is then followed by a long-term decrease in the sympathetic tone. Did you follow this? Okay. So in other words, short-term stimulation in the muscle may decrease activity in the gut, whereas stimulation for 20 or 30 minutes may increase it after the end of stimulation. So you can actually use it both for a hyperactive gut and for constipation, for example. So these effects, these long-term effects, they are dependent on the central control systems that are affecting the sympathetic activity down here. So this would basically say that if we want to treat visual organs, if we want to have an effect on visual organs, we should be in the segmental level of the visual organs if we are trying to go for the sympathetic system. Now, we are going into the brain. This is a simplified one. So now we have our brain here. And so the obvious question then is, what is acupuncture doing in the brain with the limbic systems, with the somatosensory cortex, with the prefrontal cortex, and with the reward system? So it has been demonstrated that typical for, if we take pain itself, pain, as we said, did actually stimulate this area. In some cases, also pain stimulated the reward system. Pain resulted in an activity in the prefrontal cortex and also set up activity up here. Interestingly, when we do acupuncture, acupuncture is doing basically the opposite. Acupuncture is blocking the effect in the limbic systems, like this. Acupuncture is also blocking the effect of the pain in the prefrontal cortex. And acupuncture may also affect the reward system, but in a different way. So there is a different kind of reward when we do acupuncture. So very simplified, you can actually say that acupuncture is counteracting the effects of the pain in the pain systems. Now, the important thing of this, the activity in the brain when we have pain or when we have illness is going to be different. So from a clinical perspective, we can actually say that the pain may induce a central sensitization in the pain. So what I'm trying to show now is that if we have a healthy brain, a brain in health, here we have a brain in pain, and here we have a brain in very much pain. And what I'm trying to show now is that the state of the brain is going to determine the effects that you have with your needling. So in other words, when you do light needling in a healthy brain, light needling is going to decrease the activity in the brain. So this is light needling. If you do medium needling of a healthy brain, you're going to decrease the activity. And if you're doing strong stimulation in a healthy brain, you're also going to decrease it further. In other words, this basically shows that the stronger peripheral stimulus, the more we can inhibit the activity in the brain. However, if we are using too strong, or if we use a very painful acupuncture technique, so if it becomes painful, then we have the opposite effect. The pain increases. If we now do the opposite, if we now look at a patient with very much pain, you could actually find a very different response. So if we go here, we could take first this one. So this would basically mean that the response would be like this, 1, 2, 3. Here the pain starts to increase. And then finally, if you take this one, here it could be that this decreases the pain and this increases the pain. So what I'm trying to show here, this could be 2 pluses, and this could be 3 pluses. What I'm trying to show here is that the activity of the brain is actually, the effect that you have of your acupuncture is dependent on the state of the brain. So this basically means that when you're treating a patient, a very light acupuncture stimulation technique, for example in fibromyalgia, or in a patient with migraine, may be enough. And if you're doing too strong stimulation, you may actually get the opposite effects. So this means that you have to adjust your acupuncture technique to the state of the patients. And according to studies, for example, by Richard Harris in the States, they have actually, by determining pressure thresholds before, been able to prognose which patients should receive a light stimulus and which should receive a strong stimulus to have the optimal effects. And I think this is, from a clinical perspective, one of the key points, I think, which is important to take home. And that is that acupuncture is going to alleviate pain if you choose the appropriate technique. So now, if we have, here we have the patient with pain, here you have the effects of acupuncture. Then the obvious question is, where should you place your acupuncture needles? Where, if you place the acupuncture needles segmentally, in the segmental points, you're going to have the inhibition of the limbic structures, and you're going to have the activity of or inhibition of the activity in the prefrontal cortex. If you place acupuncture needles extrasegmental, you're basically only going to have the effects in the prefrontal cortex. So in other words, to have the optimal effects when you do your acupuncture treatment, at least from a pain perspective, you need to combine segmental acupuncture points with extrasegmental points to have the best effects. So this basically shows that from a Western perspective, treating pain, you need to have your acupuncture points segmentally related to the pain, but you also need to have them extrasegmentally related to the pain. And then finally, all of these systems, of course, come together, and this is now very simplified like this. All of these systems come together to affect the descending pain inhibition. And the important thing here is that when you do your treatments, one acupuncture treatment here is going to result in the release of inhibitory compounds. So one treatment is basically affecting the release of the neurotransmitters. But if you want to have a long-term effect, you need to do about 5 to 6 treatments. So this is one treatment, but 5 to 6 treatments, then you're having an effect of the genomic expression here. That is then affecting the amount of neuropeptide that are released. So what this drawing simplified is showing is that one treatment is just a short-term effect. But to have long-term effects, you need to do about 5 to 6 treatments to really reset the system or to re-educate the system. So this would indicate that acupuncture in this perspective should be repeated if you really want to assess the effects. And now coming into the final part of it. What has been demonstrated is that some of the most important effects are on the prefrontal cortex and on the limbic structures, as we said. What has been shown is that a lot of the reactions happening in the prefrontal cortex that are associated with pain, and this is especially fear responses. So what you may have here is that acupuncture may trigger avoidance. And patients who have developed fear of movement, for example, in these patients, we maybe, so this would be the patient here, so this could be the shoulder patient. This is a typical Swede. Yes. If the patient would have a very strong fear of moving the arm, acupuncture may then be used in a very different way. Instead of treating this area, which the patient has all the attention on, possibly putting the acupuncture needle far away may be used in combination with passive movement of the joint to increase the pain. So this will basically show that we also need to adopt the acupuncture technique to the cognitive state of the patient. In other words, patients driven by strong fear responses possibly need to have acupuncture at a very distant site instead of going for the local sites. So, in summary, what I've said so far, and this is quite messy, we need to adopt the technique for the patients. First, from an intensity perspective, the needles should be as strong as possible, but not too strong, because too strong evokes more pain. The other one is that we should repeat the treatments if we want to have long-term effects. There is rationale to put acupuncture needles both in the segmental level and in the extrasegmental level to have the best and the longest term effects. And finally, we do have peripheral effects of our acupuncture needle, especially when we're treating ischemic conditions. And this is unique in the perspective that there are no other techniques that are around really to facilitate blood flow, for example, in deep muscle tissue and in deep connective tissue. So in that perspective, acupuncture is a unique technique.